bone density and prevent osteoporosis, but new research suggests it might also help protect against chronic conditions like cancer, type 1 diabetes, and rheumatoid arthritis. 6 is on call this afternoon with Ochsner Medical Center West Bank endocrinologist Mary Scanlan. It's great to see you, doctor, this afternoon.
Thank you.
I'm wondering, obviously it sounds like vitamin D is very important, and many of us don't know if we're getting enough, so how do we know if we have vitamin D deficiency?
Well, actually, it's hard to tell by symptoms if you have vitamin D deficiency. Vitamin D deficiency is actually very important for bone health. And unfortunately, the first symptom of vitamin D deficiency for many people is a broken bone. Other symptoms of vitamin D deficiency can be very subtle. And that's why it's so helpful to have your doctor check a vitamin D level. Some people with vitamin D deficiency can have muscle and joint aches, can have muscle weakness. Some even have bone pain and possibly fatigue.
What about some consequences then of possible vitamin D deficiency?
Well, the best studied consequences of vitamin D deficiency are in the bones. The classic example being rickets in children. But there's an increased risk of a fracture of a bone, even with mild vitamin D deficiency. So it's important, that's why it's important to have the level checked. With more research, we're finding vitamin D deficiency associated with a wide variety of disorders. Problems with muscle function, immune system function, increase in hypertension and heart disease, more autoimmune diseases, and even some cancers. And research in these areas is ongoing.
Dr. Scanlan, I got to be honest with you. When you go onto the store shelves now, and it's kind of consumer overload to see all the vitamins. I mean, it's vitamin C and vitamin E, and one's good for this, and one's good for that. Would it be fair for you to possibly rank vitamin D in terms of its importance?
Well, it's tough to do. All the vitamins are essential, and we need our vitamins to live. We certainly need our vitamin D deficiency, especially for bone health. We measure our vitamin D in international units, and when you're looking at those confusing store shelves, what you want to think of is that most people will, with 800 international units of vitamin D, will have enough to maintain an adequate level. But if the vitamin D level is low, people will often need a prescription strength dose of vitamin D. So having your doctor check your vitamin D level is the best way to know if you're getting enough vitamin D just in your diet and daily life.
Yeah, and it's absolutely important to ask your doctor questions, and I guess that's why they make the multivitamins.
Exactly.
All
well,
right.
And you want to make sure you have enough in those multivitamins, though, so check for that 800 international units to maintain adequate vitamin D.
We got it. Thanks so much, Dr.
Thank you.
Mary Scanlan over at Ochsner on the West Bank this afternoon. Have a good one, doctor.
Thank you. You too.
Thank